Hi everyone, welcome to my channel. This is Tiasha and today we are going to study about viral hepatitis. So it's a very important topic for especially the UG medical students, and I would say if it was really helpful, if you like the video, then please like, share and subscribe. Thank you. So hepatitis hepatitis can be, this word can be divided into two parts, that is hepato, which means liver, itis means inflammation. So this is inflammation of the liver. So what is viral hepatitis? The definition comes as it is the infection of the liver caused by hepatogenic viruses. So the inflammation is due to hepatogenic viruses in this case. So there are types of hepatitis. There are hepatitis A virus, hepatitis B virus, hepatitis C, D and E. Okay, so starting with hepatitis A virus, it is causing a fecally spread self-limiting disease, so it don't have a carrier stage or something. And we will learn about the etiological factors of these types of hepatitis a bit later. So coming to the hepatitis B virus, it is parenterally transmitted disease. For example, I can give such as in recipients of blood and blood products, then intravenous drug addicts, patients treated in renal dialysis, hospital workers exposed to blood, and by it can also spread by intimate physical contact, etc. So it can happen in any age, and it's a very dangerous kind of hepatitis, we can say, because it has an incubation period of 30 to 180 days. So it can have an asymptomatic carrier stage in which they can spread hepatitis to other people, and also if it's not treated properly in the early stages, it can lead to chronic hepatitis, and also it can progress to cirrhosis of liver, fulminant hepatitis, and it is seen that it has a role in the development of hepatocellular carcinoma. Coming to the hepatitis C virus, so previously it is termed as non-A, non-B, that is NA-NB hepatitis. So this is transfusion related hepatitis. Its incubation period is 20 to 90 days, and it can also lead to chronic hepatitis, and it can also lead to cirrhosis of liver and also hepatocellular carcinoma and the other late consequences of HCV infection if it continues and becomes chronic. I want to include a few things, that is, it is acquired by blood transfusion, blood products, hemodialysis, parenteral drug abuse, and accidental cuts and needle pricks in healthy workers. So about 90% of post-transfusional hepatitis is of hepatitis C type. So about 1 to 2% of volunteer blood donors and up to 5% of professional blood donors are carriers of hepatitis C. Hepatitis delta virus. So it consists with hepatitis B virus, or it may be like hepatitis D virus and B virus may infect a person simultaneously, which is known as co-infection, and hepatitis D or hepatitis delta virus may attack a chronic hepatitis B virus carrier known as superinfection. So the risk factors of hepatitis B and hepatitis D are the same, that is, it is parenterally transmitted disease. Now coming to hepatitis E virus, so it is causing agent is waterborne. So this is waterborne infection, or known as enterically transmitted virus. Previously it was known as enterically transmitted variant of non-A non-B hepatitis, and secondary person to person infection does not occur in this case, and it don't lead to chronic hepatitis, so it's a good thing. And only thing which is important in hepatitis E virus is there is high mortality rate in case of pregnant woman. When a pregnant woman is infected with hepatitis E virus, there are risks. Let's study about the etiological classification of the main three hepatitis which we have, that is hepatitis A virus, hepatitis B virus and hepatitis C virus. So starting with the features, first comes the we are having viral particle. So in hepatitis A virus, this is 27 nanometer, in HBV 42 nanometer, and HCV, that is 30 to 60 nanometer. If we tell about genome, then this is in hepatitis A virus, it is RNA and it is single stranded linear. Hepatitis B virus only have DNA. Okay, all the hepatitis viruses have RNA, but in hepatitis B virus we have DNA. It is single stranded or double stranded. Next comes to hepatitis C virus. It is RNA, single stranded, linear and circular. Okay, so coming to morphology, in HIV virus it is icosahedral, it is non-enveloped. Then coming to HBV, that is double shield enveloped. HCV is enveloped. So coming to the main two things, that is antigen and antibody, which is required for the diagnosis of hepatitis. So for starting for the antigen, so in HAV, this is HAV virus, that is hepatitis A virus. Okay, and HBV, we have a few antigens such as hepatitis B surface antigen, hepatitis B core antigen, and hepatitis B expression antigen. Okay, next coming to HCV, that is we have HCV RNA, C103, etc. Coming to the antibodies, we have in hepatitis A virus we have antibody to hepatitis A virus. Okay, in HBV we have antibody to hepatitis B surface antigen and antibody to hepatitis B core antigen, right? And in HCV we have antibody to hepatitis C virus. So then comes the severity. In HIV it's mild, HBV is occasionally severe, okay, and HCV is moderate. In coming to the prognosis, HIV have excellent prognosis. HBV sometimes it gets worse, especially with age, and HCV the prognosis is moderate. So coming to the diagnostic part, if we see, we have 5 columns out here, that is starting from hepatitis B surface antigen and IgM antibody to hepatitis A virus, IgM antibody to hepatitis B core antigen, antibody to hepatitis C virus, and then comes the reading. So starting with first one, if we see that surface antigen hepatitis B surface antigen is positive, antibody to HIV is negative, IgM antibody to hepatitis B core antigen is positive, and then anti-HCV is negative, we will confirm that it is acute hepatitis B. Okay, we'll confirm it. Next comes HBs AG as negative, then IgM antibody to HIV is positive, IgM antibody to HBC is negative, anti-HCV is negative, then the reading will confirm as acute hepatitis A. Okay, now coming to the next reading, we'll have all the negatives and only we'll have anti-HCV as positive, then the reading will come as hepatitis C, acute. Okay, and the next reading is all of them are negative. If all of them are negative, then we'll confirm it as non A, non B, non C hepatitis, which usually confirms, or usually it's favorable to hepatitis E virus. I hope you can appreciate this chart. And with this thing I want to tell you people that the most common cause of acute viral hepatitis is actually hepatitis E virus. So coming to the symptoms of acute viral hepatitis, the patient may have fever, nausea, vomiting, right upper quadrant discomfort and pain. On examination, we can have tender hepatomegaly, and increase blood transaminases. So let me tell about transaminases. That is normally less in the blood, but due to hepatitis, when there is damage in the hepatocytes, the transaminases from the liver gets leaked into the blood vessels, so we'll get increased amount of alanine aminotransferase and aspartate aminotransferase. So but we can see that alanine aminotransferase is always greater than aspartate aminotransferase in case of hepatitis, and also alanine aminotransferase is the last liver enzyme to get to normal state. Okay, now then we can have atypical lymphocytosis, that is increased atypical lymphocytes, and patients may develop jaundice, or you can say patient develops jaundice. We can have yellow colored urine, yellow sclera, and yellowish skin. So that's it. Before I tell you about further things, I need to tell you about hepatitis stages. So starting from the carrier state, it is an asymptomatic individual without manifest disease harboring infection with hepatotrophic virus and capable of transmitting it is called carrier state. So there can be two types of carriers: an asymptomatic healthy carrier who does not suffer from ill effects of the virus infection but is capable of transmitting the disease. And another one is an asymptomatic carrier with chronic disease capable of transmitting the organism. And another thing is hepatitis B is responsible for the largest number of carriers in the world. So coming to acute hepatitis, we can see that this is the most common consequence of all hepatotrophic viruses. It is the acute inflammatory involvement of the entire liver. So this has got 4 phases: incubation period, pre-icteric phase, icteric phase, and post-icteric phase. Now coming to chronic hepatitis, it is the continuing or relapsing hepatic disease for more than 6 months with symptoms along with biochemical, serological, and histopathologic evidence of inflammation and necrosis. And we can see most common cause for chronic hepatitis is hepatitis C. Now coming to another kind of hepatitis, that is fulminant hepatitis. Right, so this is the most severe form of acute hepatitis, which signifies rapid progressive hepatocellular failure. So there are 2 patterns. One is submassive necrosis and another is massive necrosis. Submassive necrosis having a less rapid course extending up to 3 months, and massive necrosis in which the liver failure is rapid and fulminant, occurring in just 2 to 3 weeks. So this is the most dangerous and severe form of acute hepatitis. So coming to the treatment part, starting with acute hepatitis. In acute viral hepatitis, the treatment is conservative treatment. So we can give antiemetics for excess vomiting, IV fluids for dehydration if the vomiting is very severe. Most patients recover. In case of hepatitis B, the recovery rate is 90%. So, and the jaundice will almost disappear within a month. So coming to the chronic hepatitis, starting with hepatitis B, we need to first know the severity of the disease. So we'll do a PCR in which hepatitis B virus DNA will be greater than 2 into 10 to the power 4 international units per ml. And we'll do a LFT where SGPT will be doubled. So here treatment is required. So treatment will give entecavir or tenofovir. So in case of hepatitis C, we'll do the same diagnosis, that is PCR, in which HCV RNA will be detected but with or without elevated ALT. So HTPT can be normal, and when HCV RNA is detected, we have to treat it because here the liver enzymes may not be elevated, right? So the treatment we'll give is sofosbuvir plus velpatasvir. Now coming to the hepatitis D, we will treat patients with alpha interferon. So I hope you like the video. I hope it was helpful for you. To be honest, hepatitis is a huge topic to be covered within 10 to 12 minutes. So if you want a detailed video on this topic, then please comment in the comment box. If you're having any confusion, any doubts about what I wrote or what I told about, or even if I'm wrong in some aspects, please text me up in the comment box. And thank you for watching.